course, the Princess of Presenting is in the building all the way till 5 p.m. And of course, on our Mental Health Mondays, we love to focus on all things that have to do with health. And of course, World Hepatitis Day is observed on the 28th of July. And we're here to find out more about that. Of course, we love talking about everything that has to do in the health space. And that is why we never talk by myself, because I am extremely disqualified. We have professionals in the building. We have Mike from the Epicentre, as well as Dr. Edina, who's a medical researcher. Guys, welcome to the show, and thank you for joining us.
Thank you for having us, Lua.
Yeah, thanks so much for having us.
I'm always so great that we always have professionals, because if someone asked me, I would have been like, before I had to do my research for the show, I would have been like, I don't know what hepatitis is, and that is terrible. But for someone out there who's watching, and maybe like myself saying, you know what, I actually don't know what it is, I don't really understand it, Dr. Edna, I'll give it to you. Can you please explain to us, what is hepatitis?
Thank you, Lua. And you're not alone. A lot of people don't know about hepatitis.
Yeah.
And hepatitis is basically inflammation of the liver. And there are other causes. There are various causes. You could have non-infectious causes through alcohol intoxication or using drugs.
Yeah.
But then the one that really causes us concern are those that are caused by viral hepatitis or a virus, specifically hepatitis B.
Oh, and obviously, as we know, we've had many viruses, and every time we hear the word virus, it's essentially like a jump scare word for all of us. But as you explained, it is something that may be happening to other people. And of course, you work at the Epicentre. So can you talk to us about what it is that you guys do for people who do have hepatitis, or who do come up and say, actually, I feel like I've been getting some symptoms, and this might be it, this might not be it. So you can talk to us about that, Mike.
Awesome, yeah. So at Epicentre, we run walk-in labs. We've got 3 branches in Durban, Cape Town, and Johannesburg. And people can basically just walk in and come and get a test. So if they are experiencing some of the symptoms, which I think we'll talk about, they can just come, get a test, and get a result, and go to a doctor and start treatment. Treatment is a long-term thing, but you can get treated for it, and it's good to pick it up.
Yeah.
What we have recently worked on, which is really cool, is a rapid test which allows people to test for hepatitis B really quickly. Generally what happens is you go to a clinic or a doctor and they test you. It goes to a lab, and then it comes back to you at a later point with a result. But there's a gap in the time from when you get tested to when you start your treatment. So what we're hoping with this rapid test is to reduce the time so that people actually come, get tested, diagnosed there and then get onto treatment.
I love that, and I love the fact you mentioned the rapid test, because most of the time we do have rapid tests for things that we've been suffering with as a country, for example, HIV, but of course these smaller ones that we don't really know about, we haven't had, so the fact that you guys are doing that is amazing. And of course, Dr. Edna, you are a medical researcher. Talk to us about how being a researcher is actually helping find out more about hepatitis, and hopefully finding if there is a cure, hopefully in the future.
Yeah, so that's an excellent question. So I work with the University of Cape Town with a unit known as the Vaccines for Africa Initiative. And basically what we do is we do some virology testing. That's okay. We do some virology research work and also some vaccinology research work. And that's just a very fancy way of saying that we try to understand how the virus causes disease in humans and how we can maximize the use of vaccines to be able to prevent the disease from ever happening. So that's basically part of the work that we do at the Vaccines for Africa Initiative.
One thing I always say is that prevention is always better than cure. So the fact that there are people who are working hard to make sure that we are preventing is absolutely amazing. But of course, like you said, we're going to speak about some of the symptoms. And personally, I've seen some, but I'm not going to jump at it. I'm going to let the professionals take it away. What are some of the symptoms that you need to go to the doctor for when you're experiencing, because you might be having hepatitis?
I think you should deal with those. You've been studying it for years.
I'll be happy to. I'll be happy to, Mike. So the thing about hepatitis is that it's one of those silent killers. You know, people are walking around and they don't even know that they have it, which is why testing is so important. So most people don't know that they have it, but the typical symptoms when you have an acute infection include fatigue. You might have some blood in your urine, so dark urine. You might have pale stool, and most importantly, you'll feel some pain in your abdomen, specifically the upper right quadrant where the liver is. So those are some of the immediate symptoms that you will see that will kind of flag for you that you need to get tested. But typically, it's very silent until it gets worse.
And what do we, oh no, you can add, Mike?
I just wanted to add, you can also go and check out our website, epicentre.org.za. We've got a really nice setup that explains what hepatitis are, what the different viruses are, what the symptoms are, and what you can do once you get once you've tested positive for hepatitis.
And really quickly, in 30 seconds, how do we make sure that we don't get it? If there is a way to prevent it, are there specific ways or things that we can do to make sure that we stay away?
One word, vaccinate.
Vaccinate?
Vaccinate.
Okay. Vaccinate people. What would you say, Mike?
100%,
As well.
Vaccinate.
Yeah.
Get tested if you are at risk. Yeah.
And of course, you already mentioned your website. Is there any specific website where we can go and study more of your work and really understand what you guys do?
Yes, please. So the Vaccines for Africa initiative,
Yeah.
highly accessible. Please reach out to us and we'll be happy to share any information.
And that website again, Mike?
Epicentre.org.za.
Guys, thank you so much for joining us today. I always find that it's so insightful to have people who have more knowledge about it, because obviously sometimes you read about it and you're like, oh, okay, this is what it means, but to have someone really explain it to you, and hopefully you guys are learning more. Of course, the day is observed on the 28th of July. It is World Hepatitis Day, so make sure that you guys are learning more and getting vaccinated, as the doctor has said. But right now, though, standing on the other side is my girl, Keezy Keys, and she's standing with the social media question for the day.